And we all know that you are a mentor for our Professor Mauriņa. For how long time do you know him?
Oh, that's also many years. I don't know exactly how long, you know, but in the beginning of his career, he, as I understand, he went to several vascular surgeons, phlebologists and so on to learn what they think of phlebology, how they treat patients. And at that time he came also to us, our hospital, to learn something about duplex ultrasound and things like that, treatment of varicose veins, and he stood with us for a few weeks. And after that he also came back to do his promotional work and to do his Dr. Med thing like that in my group. And so we have quite a long history of cooperation. And ever since, you know, we met at the meetings and congresses, and he invited me also to come here to his meetings and workshops. So yeah, it's a long history and friendship.
Yeah, that's really nice. And how do you see the development of Dr. Mauriņa clinic through the years?
Yeah.
I believe you have seen the beginning of the...
Yes, yeah, I think it's also a history of phlebology in the Baltic countries, because in the beginning it was also vascular surgery mainly, and then it developed towards a very professional, let's say, method, you know, with the terminal ablation and things like that. And all this, yes, he started in another hospital, in another clinic, and then he started to have his own business. And over the years, it grew and grew and grew and grew. So nowadays, with this new clinic here, it's really a very good, let's say, very fruitful development, I would say. And he is the one, I think, in the Baltic countries who does quite a high amount of varicose vein patient treatments, and he does it very professionally and very good. Yes, it's a very impressive history, not only of him, but also of the whole society in the Baltic countries. I remember very well the first workshops we did in more than 15 years ago, I would say, things like that, where many doctors in the Baltic countries were starting with phlebology more intensely. They had some knowledge about that from vascular surgery and so on, but especially Uldis founded the Phlebological Society of Baltic Society, and this society was very active in education and educational congresses and workshops, and that caused a lot of development, I would say, in all these institutions in the Baltic countries. And today, I think phlebology in the Baltic countries is top, very good. So it's also, you know, his activity which did it.